don't matter what your name is, share your story. We'll be waiting for the haters, whoa.
What's up, everyone, and welcome back to For The Hayters podcast. This episode is one of resilience, courage, and advocacy. Our guest, Melissa, is a mother of three with an incredible story about challenges and traumas she's faced in her journey through motherhood. From navigating multiple high-risk pregnancies, postpartum depression, and rare complications like cesarean, scar, ectopic pregnancies, to enduring the loss of her own mother, Melissa's story sheds light on issues that are rarely talked about, but so important to bring awareness to. Her strength in sharing her story is a powerful reminder that no one is alone in their struggles. Let's get into it. Welcome to For The Hayters, Melissa. Let's start off just by introducing yourself and sharing a little bit about you before you started a family.
Okay. Oh my gosh. Okay.
It's like, who am I before kids, right?
I don't even know.
Yeah.
Well, I grew up in Chicago. A lot of people say they're from Chicago when they live in the suburbs, but I live in the suburbs now, but I'm definitely from Chicago, deep in the city. It was great. I didn't imagine myself ever living in the suburbs of Chicago, but here we are. I have an older brother. We are 7 years apart. We hated each other till I was like 16 and got my first tattoo. That's when we started liking each other. But now we're very close and we talk literally every single day. My dad is awesome. He's a police officer. He is the coolest dad and grandpa ever. Yeah.
And that's it. Can you just give a little background to when you met your husband? Yeah.
Okay. So we met on Tinder. It's great. I never tell anybody that. We always lie and say we met through mutual friends, but we definitely did not. We bonded over Malort. You know what it is.
It's a liqueur. Or not. Yeah, right?
Yeah, it's very big in Chicago. A lot of people, you either love it or you hate it, or you take shots of it to prove you can, and you're not a baby. My brother taught me when I was 21 how to drink it, and I don't know the right way to say this. I have outshot men way older than me in Malort.
Okay.
I'm proud of myself for that. It's not that great, but what we bonded over, and we met, and I got pregnant very quickly. Mm-hmm. When they say it only takes one time, that is not a joke. It only takes one time.
So how old were you when you and your husband met, and what's your husband's name?
His name is Ben.
Okay.
I was 26. 27. I was 26.
Okay.
Yes, I was 26. And I'm 4 years older than him, which is crazy. So he was a very young child.
A baby.
He's still a baby. He'll be 30 this year, and he's still a baby.
Yeah. And when does that transition start? When do you first become pregnant? How long were you together?
Oh, Lord. Okay, so our anniversary, which is really cool, our dating anniversary and our wedding anniversary is on the same day because I wanted it. We got married on a Monday at the courthouse because I was very particular because I didn't want him to forget. So it's the same day.
Mine is also the same day.
Really?
Mm-hmm.
Oh my God, I've never met anybody that's the same day. That's awesome.
It's a day off, but same day.
It's the same day. It counts. I love that. We started dating February 10th. We told our family, well, my mom knew a few days before we told the rest of our family, but we told our families essentially on April 1st that I was pregnant, which happened to be Easter that year. And April 1st, I think my brother thought I was kidding at first. Mm-hmm. I wasn't.
So with baby number one, what was that pregnancy like?
It was okay. I had never been pregnant before, so I didn't really know I feel like nobody knows what to expect. Mm-hmm. It was hard though. A lot of people may or may not agree with this, but I absolutely hate being pregnant. It hurts. Everything hurts. With my girls, I'm ginormous. I gained so much weight both times. I was like a different person. Mm-hmm. Everything hurt. Your back hurts. My daughter's feet were stuck in my ribs for weeks. And the pain that's associated with a baby in your rib cage, you can't like typically when the baby's in like a weird spot, you can kind of push them and they move. No, when their feet are in your ribs, they're there and it doesn't go away. It was super uncomfortable. The last like month and a half, I was so swollen. My legs, my feet, my hands, my arms, everything, my face. I was super swollen, and I was convinced that something was wrong. And they did not believe me until I had to give birth, and that's when they realized something was wrong. It was fine until like a week before I had my daughter. Let me backtrack. When I met my husband, we started dating, got pregnant really quick. I was like, well, how do I know if we're going to work out? Like, I've known you for like 3 seconds. How am I going to know? He rented a house with 2 of his friends, and I moved right on in because I'm like, well, I have to know if I can live with you if we're going to make this work and have a kid, right? So I moved in with him and his 2 friends, and it was very awkward at first, but then it worked itself out. It was fine. It ended up being fine for, I lived there for less than a year. Yeah, I lived there for less than a year, but it was fine. It was fine.
I don't know if you're trying to convince me or you.
Probably myself, but it was fine. And then there was one day, so my husband is a former chef, so when he would work, he was off, I think either Monday, Tuesday, or Tuesday, Wednesday. I can't remember now. But it was a Monday night, and I at the house with his 2 roommates, who they were friends, so it wasn't like that weird, but it was a little weird. And I'm ginormous pregnant. I go to the bathroom, and you wipe, and I'm bleeding, and I'm like, oh my God, I'm dying. So I called the doctor, and I'm like, hey, I'm bleeding. What do you want me to do? And she was like, come in. I'm like, oh my God, I'm dying. I didn't die, but they felt like it in that second. So my husband is at work. So I'm like, what do I, he can't get here in time. He's not going to be here for like 45 minutes. What do I do? I literally had his roommate, who was our roommate, one of our still really close friends, drive me to the hospital, way faster than he should have. Go in there. I'm in the labor and delivery room for a couple hours. They're like, you're fine. It's just some spotting. You're fine. I'm like, okay, but I'm really swollen. Like, can you check something? I know that when you're pregnant and you're really that swollen, they would want to check your urine to see if there's protein in there to see if you have like preeclampsia or condition, right? They're like, no, you're fine. Send me home. Okay, great. That Thursday, I had my weekly check, and I got checked. When I was at the hospital, they checked and I was 4 centimeters dilated. Whoa, that's a lot to me. Okay. And they're like, do you feel anything? I was like, no. I feel nothing. Her feet are in my ribs. I just want to get her out. Like, I'm done. And I was almost 37 weeks. I was 36 in a couple days. So that Thursday, I go to the appointment. The doctor sticks her hand up there to check how dilated you are. This is so gross. She pulls her hand out, and there's blood pouring out. It's everywhere. It's all over her. She has gloves on, but it's like all over her glove. It was on her coat. Like, it was everywhere. She's like, we're going to send you upstairs. Good. Okay. Still 4 centimeters dilated. Go upstairs. It takes 4 or 5 nurses to put an IV on me because my blood pressure was, I don't know if it was too high or too low at that point. I don't remember, but it took 4 or 5 people to try. Finally, they get it. They check the protein in my urine like I complained about. And they're like, oh, it's a little elevated, but it's not that bad. Okay. So then I'm there at the hospital. So it's Thursday, late morning. I'm there all day. They're like, we're going to start you on Pitocin. You'll be 37 weeks the next day. So that's technically like a safe time for a baby to be born. Like, that's technically full term. At least that's what my doctor said. Baby's safe to come out. Cool. So I'm there. They start Pitocin at like 2 or 3 in the afternoon. I'm there. Obviously, I'm there. My husband's there. My best friend is there. My parents, my brother. We're all there just kind of hanging out. And the monitor, my friend's a nurse, and she's like, do you feel that? I was like, no. She's pointing to the monitor, and she's like, do you see that thing going up and down? I'm like, yeah, I feel nothing. And she's like, that's a contraction. It's like, oh, okay, so the meds are working. Cool. A couple hours later, they're like, we're going to give you the epidural, and then we'll break your water shortly after that. Cool. Epidural is no joke. It is no joke. That, like, hunched over, you can't move. No, my husband, you don't always get to watch it either, but at the hospital my kids were born at, my husband got to watch the whole thing, and he was like, I hope I never see that again, because it was long, and it's a long tube. It's really, really gross. Then they give you like a button. I don't know if everyone, but they gave me a button so that if I felt anything, I could press the button and it'll give me more medicine through the epidural.
Mm-hmm.
Cool. I felt nothing. Literally, absolutely nothing. Until they tell me it's time. Oh, then they break your water. I didn't feel anything during that. And then they're like, okay, it's time to push. Cool. We have to wake my husband up. I think he was awake. He slept a lot. So we wake him up. We're like, all right, it's time to push. It's time to go. Okay, cool. I'm going. And I'm pushing and I'm pushing and I'm pushing. And it feels like, again, like she's in my ribs and I'm pushing her down. I'm like, it hurts. It hurts. It's so bad. It's so bad. It's not normal. I don't think this is normal. And they're like, no, you're fine. You're fine. 2.5 hours go by where I'm still pushing. Every time they say to feel it, you know what it feels like. And like, maybe I knew what it felt like, but I also didn't at the same time because which I guess a lot of people say I'm lucky, but I would want to know what that experience is like, to feel what a contraction feels like.
Mm-hmm.
But I felt nothing. And they said push. And I'm like, okay, but I don't think I'm pushing on anything. I don't know what's happening. So after 3 hours, it is now 7 or 8 in the morning, and the on-call doctors switch. And when you're at the OB's office, you have to see every doctor in the practice. And there was one doctor, only one. That's not my favorite person. Comes in and she's like, all right, show me you can push. And I'm there, and it was just great. I have a nurse holding my leg, my husband's somewhere, and I'm trying to push. And she's like, stop, C-section, I'll see you there, and walks out. I said, okay. So they put my legs down, and I'm just sitting there just waiting. Okay.
Did you ask, and were you able to ask like questions why? Like, did they give you?
I was so tired. I probably could have. And if my husband did, I don't even remember, because to be honest, it's hard because I feel like our brains block out a lot of labor and birth in general.
Yeah, absolutely.
I think they do so that you don't remember, so that's why you have more kids, because that's why I had 3 kids. I didn't remember. Lying. I did. And so all I remember, I don't remember going to the C-section, like, surgery room. I remember just automatically being on the table, laying down. They strapped my arms down. And a lot of people get, like, the shakes from, like, either if they're getting close to where they can push a baby out, their body shakes, or, like, post C-section, post vaginal birth, you can shake. Mm-hmm. I was shaking a lot, and I felt super nauseous, and I'm telling them, like, I'm gonna throw up, like, we're giving you everything, and I'm like, I need more because I'm gonna vomit everywhere. And I just remember looking up at the blood pressure, because they have a blood pressure cuff on you when you're laying down, and my arms are strapped wide out, and they have a curtain up so you can't see anything. Mm-hmm. And I remember looking up at the blood pressure monitor, and it was just going higher and higher and higher and higher. And like, normal is like 120/80, right? Mine was at as highest that I can remember. It was like 210 to 215 over like 120-ish, 130-ish that I can remember. My husband said it did go up more, but I don't know for sure. That's what I remember. And then I remember them saying a lot of pressure, and all of a sudden I heard crying. And we didn't know the gender of my first child, and I'm just like, what is it? What is it? And they're like, it's a girl. And I just kept saying, what is it? Because I couldn't hear them. Mm-hmm. I think part of it, because I was like falling in and out of, I was perfectly conscious, but I was like sleeping. I was so tired, and all the medication they had given me was making me almost like pass out. Mm-hmm. I'm like closing my eyes in and out. And when I recognized, they said, it's a girl. First thing I saw, I looked over to my husband and said, we don't have a name. Because I was convinced it was going to be a boy. And he said, we don't have anything pink. Because we bought all, like, camouflage, everything. Because we thought it was going to be a boy. So then they took her. My husband got to go. So when you have a C-section, they cut the baby's cord for you. But then my husband can go over to her and, like, still cut a piece off. Mm-hmm. So he got to go do that. And I'm just laying there, like, I don't even think my eyes were open. I just remember, like, not passing out, but like almost falling asleep, and it was horrific. And then they're like, okay, we need you to move to this table. And I'm like, I can't feel half of my body. How am I supposed to move? But they all just kind of shove you on this little on another little bed to wheel you into recovery. And I remember them handing me a bag because I kept saying I was going to throw up. And then I fell asleep, and then I woke up in recovery, and my husband was holding the baby, feeding the baby. And I was still kind of in shock that I even had a baby at that second because I just didn't remember anything from the last 10 hours because I didn't even know how I got there.
Yeah, so not ideal situation for
No.
giving birth, your first birth, not knowing what to expect, but every like health-wise afterwards, baby fine.
She was jaundiced, so she had to wear like these goggles and lay. So like I couldn't hold her a lot. She had to lay like in the bassinets they give you. And this one in particular had like curtains all around it with those yellow lights for jaundice. So she had to stay in that. We were in the hospital like 4 days.
Okay.
Because it took us that entire time to give her a name.
And what did we land on?
Rosemary.
Okay.
Yes. Which is my husband's favorite herb. That's where it came from. I wanted to name her, if it was a girl, my only name I liked was Jordan, but my husband hated that name, and it was a struggle. It struggle. The birth certificate people came in like 6 times, like, we need a name. I'm like, okay. Once we came to a first name, they're like, do you have a middle name? And I was like, nope. It took the entire 4 days. Like, we were packed up, ready to go, and we signed the birth certificate to leave.
On your way out.
On our way out, because it took us the entire time to come up with a name. It was stressful.
Wow. And so how long, obviously there's a lot to that story in itself, and then you're dealing with motherhood afterwards. How long was it until that you became pregnant again?
Like about a year and a half.
So a year and a half goes by.
Yeah. A year and a half goes by, and I was like, this is kind of, maybe even a little bit less. Because my daughter had just turned 2, and my son was born just a month later. So, whatever that math is. And my daughter was 1. I was like, oh, I could do this again. Like, this is cool. It took me a second to get my husband to agree. And then once I was like, okay, let's do it again. He was like, okay, fine. And then that first month of trying, got it again. I'm like,
wow,
his swimmers really swim. But we were good. Everything was great. We found out it was a boy. My gender reveal. We did a gender reveal. My husband turned 25, and I threw him a birthday party, and we found out at his birthday party what the gender was. It was awesome. I was shocked, and I was probably didn't have like the best reaction to finding out it was a boy because I didn't want to, because we didn't have a lot of clothes to begin with when our daughter was born. And then once we found out it was a girl, we got loaded with clothes. Like, everything pink you could think of is in my house. Everything was pink, yellow, purple, pink, mostly pink. And then once the balloons came out of this box that it was a boy, I just looked at my best friend like, are you kidding? I was so mad because I didn't want to have to go buy boy stuff. Like, I had everything girl. Like, a girl would just be so convenient.
Yeah.
Yeah, it was the worst reaction. I felt terrible. I felt my husband, it was so embarrassing. Our families were there. It was bad. It was horrible.
I think it's okay.
It's better now. I mean, he's great. My son he thinks he's a gorilla. He's a wild animal, literally. And then there was like one day, so he wasn't due until the end of January. There was a day in December. It was like it was the day before he was born. So it was the 19th of December. And I woke up and I was like, oh, he hasn't really moved today. I'm going to go eat. The things they want you to eat when a baby doesn't move. Like, they want to drink juice, apple juice, ice cream, chocolate, all those things. So I started eating all of those things, and nothing was working. He had not moved a single time. So I called the doctor, and I'm like, what do you want me to do? She's like, we're going to have you come spend the night to evaluate him. I said, okay. So I drop off my daughter with my parents. My husband's at work. I go over to the hospital and I stay there overnight. I'm on the monitors. Now, every time I would get up to go to, and they had me on fluids too. And every time I would get up to go to the bathroom, which I swear was every like hour and a half, and I would go to the bathroom and sit back down, his heart rate would take a little bit longer to go back up. Which they said it can happen. I don't know if that actually can happen, but they said it could. I'm like, okay, it's fine. So then that next morning was the 20th. At 8 o'clock, the doctor comes in they're like, we're going to discharge you. I'm like, okay, let me go to the bathroom one more time, and then we'll be good to go. And they'll take everything off. I'm like, okay, cool. I go to the bathroom, I come back. It takes over 5 minutes for his heart rate to go back up to where they want it. And they're like, yeah, you're not going. Call your husband. And I'm like, what? No, you're going to have a baby. We'll see you in an hour. It's like, oh. Okay.
Yeah. And how many weeks pregnant are you at that point?
So between 33 and 34.
Okay.
I don't remember. The dates were a little off because I didn't track like my cycle really well exactly, but it was between 33 and 34. So I'm panicking. I'm like, this is it. Like, this is the worst. Oh my gosh, what's going to happen? So my husband comes, it was so fast. And I thought the first time was kind of fast. This time was like, you're in there. And when you get a spinal, when you have like a scheduled C-section, you get a spinal, you don't get an epidural. So it's a little different. So like 6 hours later, you can actually get up and walk around versus an epidural. You don't move for like a day and a half. At least I didn't move for like a day and a half. And the spinal pain is just as bad as an epidural. Not fun. So I get the spinal, I'm laying down, everyone is rushing, and there's so many people in a C-section room. There's anesthesiologist, he has like an assistant, the OB, I had 2 or 3 OBs in there, and at least 8 or 9 nurses. And then there were 2 or 3 nurses designated for the baby when he came out. So there were so many people in this room, and you're so like exposed, and your guts are hanging all out. It's great. And all I remember them pulling him out. He did cry. Wonderful. They go over there. My husband is we're trying to take pictures and like, oh, this is such a sweet moment. Okay, great. They take us to recovery. It was fast. I thought, okay, he's fine. Cool. Excellent. We're in recovery. And they're like, we want to check his glucose levels because he's so early. I'm like, okay. Check his glucose levels. Like, oh, he's a little low. We're going to have you feed him. I'm like, okay. And because he's so early, they're like, we're just going to give him formula. I'm like, whatever. I don't feed the baby. I don't care what you feed him. Just feed him. Feed him, we're good to go. And he's not really eating a lot. I'm like, okay, well, we're going to let you guys settle. We're going to bring you to your mother baby room, like after your post-recovery room where you're going to stay for a couple days. And we'll see what happens. I'm like, okay. Because it was so this was the 20th of December. So because it's the week of Christmas and my husband being a chef at the time, he had to go to work the next day and prep for Christmas catering. So I was there by myself, and I remember this so vividly. I didn't for a while, and then it was like I dreamt it, and then I'm like, oh wait, that really happened. And now it's like it happened yesterday. Being in the room, and they would come and check his glucose levels all the time. So his feet had so many little pricks on them for checking his glucose. They would monitor how many ounces of the bottles he took, and it wasn't a lot at all. He wouldn't even take an ounce at that time. Not even half. It was very minimal. So I just remember they brought in a social worker, a nurse, the OB, a pediatrician, and somebody else, and a different type of bassinet. So my husband was calling me at that time, and I wasn't answering because I'm talking to all these people. And all I remember them saying, I remember it vividly, but at the same time, I don't remember everything they said. They said to me, okay, we're going to take him to the NICU. And I was like, no. They're like, no, we have to. No, you're not taking him out of here. And like, no, we're taking him. So my husband's FaceTiming me. I finally answer just to answer the phone. And I'm just hysterically crying as they're literally pulling him off of me, putting him in this bassinet, and taking him to the NICU. And I'm left there by myself.
I'm curious what was going through your mind, the hesitation of them taking him to get help in the NICU?
I think it was a lot all at once. I appreciate the NICU looking back. In the moment, I was like, you don't know what you're doing. I don't even know what I'm doing. How do I know you know what you're doing? Like, and I'm his mom. If I don't know what I'm doing, you're a stranger. How are you as a stranger going to know how to take care of my kid when I clearly can't fix what's wrong with him? So I was just like scared. I think scared of the unknown as well, of not knowing what's going to happen. Why is he going? What's going, like, really nobody had a lot of answers as to why he's going, except he's not eating very well. Okay, like, let's give him some more food. Like, he's a baby. He'll learn how to eat, right? So finally, I just kind of I had no choice but to let them take him. Now, because this was what year was he born? 2020, pure COVID. This is pure middle of COVID. I had to make an appointment to go see him in the NICU. And me and my husband couldn't go together. So that was horrible. And I wanted to go. The second he was down there, I wanted to go. And I had to wait hours until I could go. And I remember when I left the room, like my room, to go down to somebody to take me to the NICU, I remember looking out on the wall outside of the door of my room. Now, I don't know if all hospitals do this, but the one my kids were born at there's a picture on the wall. And they have different types of pictures. They have ones for NICU, ones for baby in the room, ones for angel babies that have passed away, or there was one more that I can't remember, or if there's like twins or something like that. And that picture is on the outside of your room so that the nurses know where your baby is. So they know to like be more gentle with you, or, you know, maybe don't come in as often, or, you know, whatever. Okay, fine. So I remember I finally was able to go downstairs. He had IVs in, monitors everywhere, a feeding tube in his went through his nose. I've seen him go through the mouth too, but his went through his nose. I was like, no, this is like, we're taking, like, no. He's gonna be here for a day. We're gonna go home tomorrow. Like, was my mentality. And the nurse, and there's different stages of the NICU too. I don't remember what they called, like, the spaces, but his was like, there's like you're almost going home, then there's the step before almost going home, and then like the next step, and he was in that next step. There for a day, maybe 2 days, maybe 3 days, 2 or 3 days, because they had to monitor his glucose levels, because his glucose, I think it was extremely low because he wasn't eating enough. So once those levels were in that certain range, I guess the good range, for so many days, they moved him to the next stage. And then he was in there for so many days, and then he went to the next stage, and he was there for like 3 days, and then we got to take him home. So he was all in all there this is not a long time. It was only like 10 days. That's not a long time. So many babies are there for 20, 30, 100 plus days. And you see that when you're there. And the NICU community is something, if you're ever a part of it, you will cherish, because the people there, the nurses there, are a different breed of human than I've ever met in my life. Mm-hmm. They care so much about the babies. The NICU families, former NICU families, my son was there for Christmas, because he was born on the 20th, so he was there for Christmas. And we got to go, and we got gifts. I was loaded with gifts from former NICU families, current NICU families. We just got all this stuff. They had Santa come visit the NICU babies, they had pictures. It was super sweet. But I hated it. Me and my husband couldn't go together. I had to make an appointment to go see your own kid is like a really hard thing to comprehend. And I think what the hardest part was, the second they took my son out of my room, like like your mother baby room, and took him to the NICU, I was literally by myself. My husband was at work, and no one came to check on you. I think the social worker came when they took him and when we got discharged. And my OB ended up keeping me there an extra like 2 days to see if he would be able to come home with me. And he couldn't. But nobody comes to check on you. They only come in every so often. Here's your medication. All right, we're going. Let's check your vitals. How's your incision? Okay, bye. And that was it. And I'm like, that's horrible. It's horrible. I don't think it's horrible. Some NICUs and some like children's hospitals are way better about that, at least from experience and research afterwards. But where I was, no one comes to talk to you. So you're sitting in there by yourself in your own thoughts, like, what's going on? Is he okay? I mean, and you can call down there as many times as you want, but you also don't want to be a bother to them because they're checking on them. And it's one nurse to like 5 babies, 5 to 6, like 5 babies.
And where's your daughter? Who's taking care of your daughter while?
So she was with my parents, and then she went to my in-laws as well until so she was with my parents for like 2 or 3 days, and then she went to my in-laws' house for the remainder. And then once I came home, they brought her home to me, and she was like, "Where's baby? Where's baby?" I mean, she was only freshly 2, so her vocabulary was not the best. Mm-hmm. But she's like, "Where's baby?" We've been practicing and telling her, "There's a baby in here." We gave her a boy baby doll. She knew it was a boy and could get she doesn't really get the difference, but she wanted to know where her baby was. And I was like, "They're at the doctor." Like, what do you say? That makes it harder, because like now I have my other baby who still wants to snuggle and hold on to me, but I can't have both of them. Mm-hmm. And leaving him there was horrible. Like, my husband's he's not a crier. He's not like a super emotional person. But when we were leaving, he literally fell to his knees crying because we had to leave our son there. And you don't get that unless you're there. Unless you physically are leaving your child in somebody else's care while you drive away and have to go home. It's unreal. It's unreal. It's an unreal experience and feeling. And I'm Grateful for the nurses there, except one. I didn't like one, but everyone else was wonderful. I called probably more than I should have, and everything was good, but it's scary. And then when you bring him home, we get to bring him home on New Year's, the day before, the 30th. So he was literally there only 10 days, which is not a long time, but that 10 days felt like 10 weeks.
Yeah.
When you're going through it. And when we got to bring him home, and now I'm home, and he was very small. He was only just a little over 5 pounds. He was very tiny. I'm like, what do I do with you? Then I wonder, like, all these other people were taking care of you. Do you know I'm your mom? Do you think they're your mom? Like, do I smell different? Do you remember what I smell like? Like, you don't know, and that's a scary thought.
It is, yeah. Yeah, and then you know, when we talked, you mentioned that you didn't experience postpartum depression during your first pregnancy, right? Like, and so you're home with this child who is so fragile, right? Just spent 10 days in the NICU, emotionally just drained from that entire experience, emotionally drained from just about everything at that point. And then you do start seeing signs of postpartum depression.
I think for me, it was pretty immediate. Like, the second they took him out, I was like, okay, well, now what? And I think postpartum depression and postpartum anxiety, at least for me, went hand in hand, because I was so anxious and nervous and worried all the time. Like, what's he doing? Is he okay? Is he breathing okay? Does he still have his feeding tube in? He ended up ripping it out at one point. My husband had to watch them put it back in, which thank God I wasn't there, because I would have ripped it out of her hands. But always wondering, like, what if this? What if that? And then when we got home, and I have this he was so tiny. He was just so small. Like, 5 pounds is not heavy.
Mm-hmm.
And we're like, take care of this little 5 pound thing and worry about how much they're eating. Like, okay, is your glucose too high? Should I get a glucose monitor and check your glucose now? I have to, like, write down every feeding how much he ate. We had to go to, or we did Zoom calls with a speech therapist. So with a newborn, a speech therapy, they help, like, give you tips on how to feed them so they intake more of the formula.
Mm-hmm.
So he can, eat more and better. I had to go get special bottles and special nipples for the bottles, and to make sure, and you had to hold him a certain way and burp him a certain way to make sure you would open up enough space for him to be able to take more. And I'm constantly worried and nervous because he's so small.
Yeah, absolutely.
For this little human.
So, how do you deal with the emotions, right? How do you take care of yourself while trying to take care of two, like, little babies?
That's a great question. And if I truly had an answer, I think I would give you one, but I don't know. I think I just kind of blacked out and just went through the motions, and he cried a lot. So I think a lot of it, the taking care of myself didn't really happen for a long time.
Mm-hmm.
Even now, still sometimes. Especially then, because he cried constantly. If he was awake, almost all the time he was crying. And nobody could figure out why. I thought he was a colicky baby. We had to give him gas drops and we had like 2 different kinds of drops, a vitamin drop that we had to put in his formula. We had to give him very special, very expensive formula, and it was terrible.
Yeah.
I didn't take care of myself at all.
Was there ever a moment where it felt like you could breathe? Like, when did that come, right? Like, was there an age that he turned, or like something that happened where things felt like everything felt like, what's the word that I'm looking for? Like, manageable, like life felt manageable. It didn't just feel overwhelming.
When he turned like 10, 11 months, we had just started looking for house. It's like we had rented a house. So we were looking to buy a house, and that's when we moved to the suburbs. So when he was like 10, 11 months is when we really started looking hard for houses. Mm-hmm. And it was like one day he woke up and stopped crying. It just woke up and I'm good now. Thank God. And it was awesome. And he was fun and smiley, and he was so photogenic, and he's so smart. He is so smart. He's crazy. He's like a feral.
And what's his name?
Barrett, but we call him Bear, which suits him strong, which is really funny because when he was in the NICU and we would like post about it on like social media, like to our friends and family, we kept saying Bear Strong, which actually Barrett does mean Bear Strong, which we learned later on afterwards. And it was good. He woke up and was good, and I was like, oh, okay, this is good. And then we were like, okay, we bought a house and we moved to the suburbs, which was still crazy to me. Years. December 7th of 2021 is when we moved in our house exactly, and it still doesn't feel like I live in the suburbs because I don't know where anything is. Costco, Jewel, and Target, and my kids' schools.
I'm just so fascinated after, 2 not really easy pregnancies and that whole entire aspect, you decided to have a third? Was
She was a little bit I wasn't not trying. I wasn't protecting, but I didn't try.
Okay.
So she was a little bit of a surprise. But after my son was born, he was born in December, so that August-ish, I started having like really bad pelvic pain. I didn't know what it was. It just hurt. It was almost like cramps. So I went to the doctor and to my regular OB just to see what it was because it had hurt for like a week or two. She was like, well, we're going to do a pregnancy test. I was like, oh, there's no way. That time I knew there was no way. There is no chance. No chance. Turns out she was right. Pregnancy test came back positive. I'm like, oh, okay, then why does it hurt so bad? Like it didn't hurt like this with my other 2 kids. Like it really hurts. She said, well, let's check your HCG level, which is the pregnancy hormone, and we'll see what the result is. And I'm like, okay. They checked that. It was really low. I don't remember the numbers, but it was very low. Again in 2 days because they want to see it double every 2 days. Okay, great. Go back in 2 days, get it checked. They call me with results. They're like, it went up, but not a lot. Let's check it again in 2 days. I'm like, okay. Check it again in 2 days. They give them the blood. I leave, and they call me, and they're like, okay, we're going to have you come in because it only went up like 7 points or something. I'm like, oh, okay, that's weird. I went to a different location. I go in there, and the doctor's like, we want to do like an ultrasound, what's it called?
Transvaginal ultrasound?
Yeah, there we go. You would think I know. So they want to do that, and I was like, okay. So she sticks it up there, and there's nothing in my uterus at all. And again, having 2 kids, I know what it looks like. There's nothing there. But why is the pregnancy hormone present? Low, but the number's low, but it's still present. And why does it hurt so bad? She's like, okay, we're going to have to send you to the hospital. And I was like, okay, but why? And of course, it was the same doctor that delivered. The same doctor delivered both my 2 kids, my first 2 kids, and the only one I didn't like. She's like, oh, you probably have an ectopic. We'll send you to the hospital. I'm like, I don't even know what that is. So
what an insensitive way to say that.
It was so terrible. So I'm like, okay. And she walks out. So I'm sitting there, putting my clothes back on, getting my phone, trying to Google what it is. And the nurse comes in. She's like, are you okay? And she was super nice. So sweet. And she's like, are you okay? I was like, I don't even know what the doctor just said. I have no idea what she just said. She's like, okay, so you have an ectopic pregnancy. It's probably in your fallopian tube. So you have to go to the hospital. You're going to get these shots, and then you're going to have like a natural-ish
miscarriage.
Essentially.
Yeah.
I'm like, oh, okay. Got it. Okay. My husband waited in the car with our kids while I had this ultrasound because I don't know if we were out and they told us to go and we had to go there, whatever the situation was. I was in the car, and he's like, all right, so, how far? What's going on? I was like, no, it's not there. He's like, what do you mean? So I'm having to explain to him, like, I don't even know. I don't know what I mean. So we go home. I drive myself to the hospital then, and because they told me to go that day. I think I went that day. I went that day or the next day. I don't remember. I get there. I go up to a labor and delivery room, and they were there a lot nicer, and they explained what it was. So regular, I don't want to say regular, but an ectopic pregnancy is basically where a fertilized egg implants outside of your uterus. More than often than not, it's in the fallopian tube. And typically, if you catch it early enough, they give you 2 shots of medication called methotrexate, which is actually a chemo drug. And they gave it to me 1 in each thigh. And that medication, they gave it to me like I think it was like an hour apart, something like that. And they said, okay, it'll pass naturally. And in the moment, I was just like going through the motions and just wanted to go home. I'm like, okay, like that's fine. I was playing on my phone. I watched TV. I was like, I just want to leave. Like, this doesn't feel real to me. I think you're lying. I don't think they're lying, but like, I'm like, this is not real. I just want to go home. So I went home and like, I also did ask, what am I supposed to expect afterwards? Is it going to hurt? And they're like, no, you shouldn't be too bad. It'll be like when you're on your period. I'm like, okay, fine. It was not. I went to work the next day because I need distractions. I'm not good at just like sitting in the moment in my feelings. I can't. It's just not how my brain processes things. So I need the distraction to distract me from what I'm actually feeling, which is the healthiest way. But in the moment, that's what I needed. So I went to work, and as I'm at work, I was like, oh, okay, it kind of hurts now. I go to the bathroom, and they tell you it's going to be like your time of the month. They lied. It is worse. It was horrifically painful. I'm in the bathroom calling my boss on my phone, like, I need you to bring me materials so that I can like clean myself up in here because it is horrifically painful. And then afterwards, at that point, then I decided to Google what it was like post having those injections. And every article I had read said the pain was horrible. It was bad. It was just bad.
Yeah, it's interesting that they told you otherwise, right? Like didn't prepare you, didn't tell you you should probably stay home from work.
I was going to go to, I was like, I think I even asked them, am I okay to go to work tomorrow? They're like, yeah, it'll just be like your period. Okay. No, it wasn't. It was so much worse. So much worse. And the pain really only lasted like a day or two, but it hurt so bad. So bad. And it was like almost like it feels like your uterus is like contracting, okay? Like it does on your period, but like on crack. Like it was so strong. You could feel it as it's happening. You could feel almost like I don't know if that's what a contraction feels like, but it feels like it's squeezing in your pelvic area. And it was absolutely unbelievable, and it was horrible. Horrible.
What does that process look like mentally outside of physically, right? Like is that, how long did you think that you were pregnant for?
Not a long time. They said I was probably between 6 and 8 weeks. Probably, but they can't be for sure. My periods weren't very regular post-birth, post-second C-section. They would come, but it was never like super routine or super on the day or anything like that. They were just kind of irregular. So I would say anywhere between 6 and 8 weeks.
Okay. And so what was that like mentally recovering afterwards, right? Like was it, this happened. I mean, you weren't trying, right? Like and yeah.
And I think this is where the thoughts started to begin of like, why is my body doing this? Like what did I do in a previous life, or what am I doing currently that is causing my body to not be able to carry? Like there's something wrong, because clearly I can get pregnant in a hot second, but it wasn't in the right spot. Like what was wrong? Like what's wrong with my body? What's wrong with me that's making that happen? And in hindsight, I know there's nothing wrong, but when you're going through that, you can't help but think that there's something wrong with you that's causing this to happen, even though it's.
And I mean, the awareness behind that is not really there either. Like it happens more often than most people know. Like it's a lot more common.
It is. And that's the thing is that itself isn't talked about enough, because I didn't know anybody that had one. We had posted, so like when we found out what was happening, it was the next day I had to go to the doctor, because we told like my mom was sick. We told my dad, we told his parent, my husband's parents, and it was weird. It was just uncomfortable, because it's uncomfortable, something you have to tell like your parent, because like,
of course.
My dad wants to know if there's something wrong with me. He wants to know. Let's make sure I'm okay. You know what I mean? And that's like an awkward thing to tell somebody else. And because it's not talked about enough, once I was like, okay, maybe if nobody I know has ever posted about this, what if somebody else has gone through this, and me saying that I've been through it will help somebody else? So I did that. I posted that and on like social media and Facebook, and I had somebody reach out to me saying, I didn't know anybody either, and I went through the same thing. And I was like, oh, okay, so it's not just me, because you feel like you're by yourself.
It feels like alone. You just feel alone in it.
Very lonely, and you're not at all, but it feels.
Yeah, and then how long after that did you get pregnant again?
So then that was in August. It was like the end of August, like first week of September that happened. And then I got pregnant again in February. Okay. Shockingly. I wasn't not trying, but I wasn't trying at the same time either. But I was also very scared this time. And now this time, because we had moved, I my previous OB was super far away. It was like, it's like a 45-minute drive, which realistically isn't that far. But when you have 2 kids, you have to sit in the car. You have to go to the appointment. That's too far. Too difficult. So I went to an OB closer to my house, and I had like previously told them of everything that had gone on. Like, I had an ectopic, I've had 2 C-sections that I didn't want, but I have no choice. And they were like, okay, cool, let's come in. I had earlier ultrasounds to confirm and HCG checks to make sure everything was, going as it should. Good to go. I'm like, cool. We find out it's a girl again. Everything's great. I was huge all over again. This time we had planned a C-section for 39 weeks exactly. So she was exactly born on 39 weeks. Everything was going great. Her name was picked out, which was the best way to pick out a name. This is my favorite name. I like kids dearly, but her name is probably, the way we came about her name is probably my favorite. We were in the hospital, like the pre-surgery room, and down. My husband, her middle name is Sue, after my husband's grandma that passed away. And we looked down at my hospital bag, and now her name, my husband really wanted Poppy, like a poppy seed. I just didn't love it. Like, I think it's cute, but I just don't love it. So I was just going to go with it and whatever. But we looked down, on my hospital bag are chili peppers covering the bag. And he was like, where'd you get this bag from? I was like, I don't know. I found it in the basement. Like, I needed to pack last minute because I forgot. Like, I don't know. He's like, that's my grandma's bag.
Oh, cute.
I was like, oh my God, her name is Pepper. So Sue after his grandma. So it is Pepper Sue. And she is just the spiciest, sometimes sweet. She's always sweet, but she is a very spicy. It's like so perfect. So everything was going fine for her, like planned C-section, going great. I'm in the room, I get that epidural. The only thing I hated is that this hospital didn't allow pictures in the surgery room. So, like, as they take her out, and I actually got to hold her, not great, but he had help, but I got to hold her on my chest, and I don't actually think he cut part of the cord off there, but they couldn't take any pictures in there. Hated that. But I'm laying on this table, and the doctor, of course, another doctor that I hadn't even seen while pregnant, is doing my C-section. This time I didn't feel, sometimes with C-sections, my first 2, I felt like a lot of pressure, and I could feel them doing things. It didn't hurt. This one, I didn't feel anything, absolutely nothing, which was awesome. And there were mirrors in there, so my husband actually got to watch everything, which is gross. So they're doing the cuts and doing whatever. And the doctor says, before she even cuts like my uterus open, the doctor says, oh, I can see the baby. What? She's like, your scar tissue is so thin, I can see the baby through your uterus.
Wow.
I was like, oh, okay. I didn't even know what to say. And they asked me a ton of times if I wanted a tubal tie, because my 3rd kid, do you want your tubes tied? And I just kept saying, no, I don't. I don't know if I'm done. I don't know. And tubal tie, it scares me because you can technically.
Yeah, especially having to make that decision in that moment too.
Yeah. And you can still have an ectopic pregnancy if your tubes are tied. It can be stuck in your fallopian tube, and then it could burst, and you could. No, I didn't want it. So she is telling me that she can see the baby through the scar tissue. I'm like, okay, well, get her out. Okay, she cuts her out. Everything's fine. As they're cleaning off the baby, my husband's holding her. We're doing great. They're trying to stitch me back up. And she's like, it's a good thing you don't want a tubal tie because I don't see them. What? Okay. And when you're in that moment and you're so vulnerable laying on this table, and there's doctors and nurses and people everywhere looking at your exposed body, and you're saying things like that, you're just like, okay, let's get it over with now, let's go. And I was just kind of in shock. Like, this is so then everything's fine, she's perfect, great. We go to like our recovery room, everything was great. I'm holding her, she was perfect. Go to the like mother baby room, and the doctor ends up coming in to do like the final check before I get discharged, and me and the baby get discharged to go home. And I was like, what do you mean that you couldn't find my tubes? And she was like, there's so much scar tissue down there, you can't find them. I'm like, well, what causes that? She's like, C-sections. Oh, no shit. Okay. How do you fix that? You can't. Okay, can I have another baby? Probably not. Oh, and at that point, I'm just like, I don't even like the way you're talking, so I just wanted to leave. Like, I wasn't even sure if I hadn't even taken the baby home yet. I don't even know what life is like with 3 kids. How am I going to know if I want another one? Because I just didn't know for sure. My goal in life was always 5. I'm never getting to 5. But in the, it's 5 is a lot. 3 is a lot. But
Yeah.
I didn't know in that moment. Yeah, it was horrible.
And so now with 3, you have 3 babies. How is mental health when you come home with third? Do you experience any postpartum then?
I don't think so. I think I was just nervous in general, and I don't know. It was very overwhelming. The one thing that I have learned for me that has been the absolute hardest thing about being a mom is the overwhelming feeling of just being overwhelmed by sound and touch. Things and on the floor and toys and just.
Yeah. I mean, that's pretty common, I think, right? Like just
So I also don't know if the being out touched or like being over touched and overstimulated. I didn't really know that was a thing until I'm here. And even now, my kids are 2, 4, and 6. I'm like, by 7 o'clock, I'm like, go to bed. We're done.
don't come near me.
Done for today. Get out. Like,
Yeah.
your rooms. This is it. Like, I can't. If that's probably the hardest thing, because then my kids are wonderful, but they're constantly talking.
Yeah.
You want a baby to talk, and they don't shut up.
Yeah. And through this all, what do you wish more people knew about ectopic pregnancies and C-section complications?
That to tell people that it's a problem, that it can happen, because I didn't know an ectopic pregnancy could happen until it did. And then when I had like the worst of the worst ectopic, I didn't know until it was. August of 23, I find out again I'm pregnant. I'm like, okay, cool. We're done. I'm good to go. And I felt that cramping pain again, but it wasn't as bad.
So this is after the third.
Yeah, she was born 11/18 of 22. So August of 23. I get a positive test. I'm like, okay, like we're done after this. 4 is my limit. I'm good. I'm good at 4. I go get early ultrasound again, and they're like, yeah, baby looks great. I'm like, cool. I was like 6 or 7 weeks at that time. So then, yeah, like 6 or 7 weeks. So for you usually don't go to the OB till you're like 8 weeks or longer, typically. So it was like around 8 or 9 weeks. I went to for my first like OB check. She puts the Doppler on, doesn't hear anything. It took her like a second. She puts an ultrasound on, can't find it like on my stomach.
Yeah.
Like, maybe it's just too early. Maybe your dates are wrong. We'll send you downstairs to do another transvaginal ultrasound. Okay, fine. So I have to come back a couple hours later. I'm doing it. I see it. And now, if you've never had a transvaginal ultrasound, it is this long probe thing that they stick up there. And the pain, when they were pushed on it, sometimes it's very uncomfortable. And she's like, the ultrasound tech is like shoving it in different directions, trying to get a good view. And I see a little flutter. I see what a baby looks like when you're that early. I can see it there. She's like, okay, we're going to have you wait over in this like waiting area. And I was like, what does that mean? Why am I waiting? Like baby looks fine. Can I go home? They're like, no, you have to wait. So the nurse comes over and talks to me and hands me a phone. Not like a cell phone, but like a those like old cell phones from what is that, Joe?
Like a brick phone?
Brick phone, like an old brick phone. She brings me this phone, and it is the doctor that delivered my third. And she said it's so flat with zero compassion, and said, I'm just telling you right now, you have a cesarean scar ectopic. We can't take care of this here. We're going to send you to another hospital. They're going to call you later with the details. Do you have any questions? Yes. What is that? What do you mean, take care of it? What? Like, what is that? I don't know what any of that means. Because you can't keep this baby, because if you do, you and baby will die. That's exactly what she said. And I just said, I don't understand what that is. She just said, it's not in your uterus. It's in the scar tissue of your uterus. So you have to go get it removed, or your uterus will burst and you can die. Okay, got it. Cool. So I just left and went home, and I didn't know what to do. And I was sitting there. I am calling my husband in the car, and I'm hysterically crying because I don't know what that means. I don't know what to do. Do I actually follow what you say? Do I go to get another opinion? I don't know what to do. So basically, the next thing that happened is I go home. I sit on my couch after crying for an hour. Somebody calls me from a number I don't know, and I just usually I don't answer numbers I don't know, but something in my gut just told me to pick it up, and it was a care coordinator at a bigger hospital in the city of Chicago. And she said, "Hi Melissa, how are you? I'm so sorry." And I was like, "How do you even know what my name is? How do you know anything?" And the OB's office had called these doctors in the city, and it had explained that I had, or what they thought was, a cesarean scar ectopic. That they couldn't treat it there, and that I needed to go to specialty care. So it took lots of phone calls and lots of coordinating for them to figure out that the next day. So this was, hold on, I can tell you the exact date. It was August 30th. I think that's a Wednesday. They told me that I have this, and I still didn't really know what it was 100%, that I have this cesarean scar ectopic. Okay. The next day, they're like, "We're going to have you come down to the hospital. You're going to need to be here at like 6 in the morning, 6 or 7 in the morning. We'll do some higher strength or higher advanced ultrasounds to confirm, and then we'll go from there." Fine. My dad drove me to the hospital because my husband, I have my 3 kids. We got to figure out this was so short. Like, I don't know what do I do with them? It's not easy to think of pull childcare like out of thin air. So my husband had to stay home and figure them out. My dad drove me, walked me in and dropped me off. I go in this room. I had a bag. They told me to pack a bag with an extra set of clothes and, a book and whatever, and a phone, your phone and charger, whatever. So I did. I'm in this room, and she's like, "Okay, I meet the lady that was talking to me, and she's like, "This is what we think is going on, but we have to confirm, and then we'll tell you more after that." Okay, fine. So I go in this ultrasound room, and ladies doing the ultrasound, and the ultrasound tech was very nice, but she was like, "I get these literally every day. People think this is what they have, or hospitals think this is what they have. I do at least 3 to 5 a day, and 75% of the time it's not even that. It's just a low fertilized embryo." Okay, cool. So I'm thinking I'm going to be good to go. I'm going to get to go home. Does the ultrasound, and she's not talking. So I knew, and I saw it again.
I feel like that's pretty inconsiderate to give some kind of false hope after like already being given bad news. So
yeah, and when you get like surveys after you leave hospitals, I had mentioned that I didn't write her name, which I'm sure they know her name because they know who does what in a hospital, but I didn't think this the bedside manner, and again, false hope and things like that shouldn't be so willy-nilly. Don't do that. I'd rather you tell me I don't know. I would rather you say you didn't know what was going on or whatever. So she does the ultrasound. She doesn't talk. She's like, "Okay, we'll be right back." So again, I'm in a very small room, and I'm on this bed with my gown over my legs, and one nurse comes in, another nurse comes in, a doctor comes in, another doctor comes in, another doctor comes in, and another nurse comes in, just piling in this room. And they do the ultrasound again, and this little man, I will never forget this short little man who said, "Yep, it's he had an abbreviation for it. I think he called it I think a CSP is like a typical abbreviation for it, but he had like an acronym for it, but I don't remember what it was." And he's like, "That's what it is. Here's what we're doing. We're gonna do one procedure where we have to basically, I don't know if it's called, okay, this we may need to cut out because I don't know if it's like the right term, if it's like a medical abortion or not. I don't know if that's like the right way to say it. But that's essentially what it was." He's like, we're going to get everything together, get all the doctors and nurses together. We'll come back here in about an hour and we'll be good to go. And we'll start the procedure. I'm like, "But what is that? What does that mean?" Doesn't tell me anything. And they say, "Get dressed and we're going to go put you in a waiting, like a private room to wait." So I'm in there texting my husband, freaking out. I'm like, "You need to give me something. Like, can you give me something to calm me down? Because I am like almost hyperventilating. I don't know what's going on. Everything is happening so quickly around me and I don't understand any of it." It was terrible. So a nurse worked really hard, and I will forever be grateful for her. She gave me a Valium, but only like 5 minutes before I was supposed to have this procedure done. She was great. Thank you for the Valium. I wish it kicked in quicker. So I go in this room. I had like my shirt on, but I had just a gown over my legs. There are so many people in this room. I have 2 nurses by my head, one on each side. I have the ultrasound tech with the ultrasound. I have 3 or 4 doctors and 2 or more nurses in the room. So many people in this room. So they stick the probe up there, the ultrasound probe up there again to monitor everything. Now, this is when they start telling me what they're going to do. They're sticking a tiny tube. This is literally the most dramatic, traumatic, horrific part. They stick a little tube up there, and they're going to stick a needle into the fertilized embryo to essentially stop its heart, essentially. And it was either that or take your uterus out. And I didn't know if I wanted any more kids. And I was like, I need to do what's best for me. I have 3 kids. If I did ask like the risk of what if I don't go through with this? What if we don't do this? They said, if you don't and it grows and it is a full baby and just scar tissue. Like, I mean, if anybody has a scar tissue is not enough to hold a baby. Let me go back. So technically what a cesarean scar ectopic pregnancy is where a fertilized embryo implants itself in the scar tissue of your uterus. So it's not in the inside of your uterus, it's in the scar tissue that's built up from your uterus being cut open, if that makes sense. And that's where it was. So you have to choose. Do I want to be here for the 3 kids that I have and risk dying, or can I take care of this and fully be there for my kids and my family? So that was the decision I had, and I'm by myself because my husband had to figure out our 3 kids. So I'm there by myself, and okay, let's do it. I need to be there for my kids. So they stick the tube up there and they stick the needle up there, and they have to distribute 5 milliliters of whatever fluid it is. I don't even know what medication was called. They had to do 5 milliliters of that. The second they stick that needle and start injecting the medication, my entire body tenses so tightly, and I am screaming, literally screaming in pain. I have never felt, I've had 3 C-sections, and recovery from a C-section is no joke. Especially when you've had so many, it is hard, it hurts. If you have staples or stitches or whatever, it is horrible. It's hard. This was on another level of pain that I don't wish on my worst enemy ever. And so I'm screaming, I'm crying, and the nurses are trying to calm me down. They're giving me ice packs because I'm sweating because it's just so bad. And I'm crying and I'm telling them to stop. I'm like, I can't do it anymore. You need to stop. Take it out. I'm screaming to take it out. And finally they take it out. They didn't end up injecting all of the medication that they needed to, but whatever amount they did the job. I guess it did what they needed it to do. And they take everything out, and I'm stuck on this bed, and I physically can't move my body. And I've never felt that experience before, where I physically can't move my arms or my legs or anything, because my whole body tightened so bad. It's like when you get in a car accident and your body tenses because you know it's coming, but then you can't move. And it was horrible. And I remember asking, through my tears and screaming, this little man doctor that did the procedure, gave me the medication and whatever, am I going to have any more kids? He's like, oh, not a chance. Got it. Okay. Not a chance. It was like so nonchalant to him. And I'm like, you just told a woman who may want another baby, and no, that's not the answer I want to hear. I want to hear, maybe, just lie. I almost wish you would lie. So after that, and after about 45 minutes to an hour, my body finally calmed down and I was able to move. I go back to the little waiting room they had me and get my stuff, and then they take me to a room. I'm going to spend the night there, because then the next morning I had to have a DNC to remove it. Which also, that hurt a lot. And that morning my husband got to come. We're in like a pre-surgical area, and I was fine. I was like, I just want to move through the motions and go home. Like, I'm good. Okay, do you have any questions? No, I just want to go home. And they were all super nice. I was almost in the moment, it was almost like an out-of-body experience. And I was almost like laughing with them, because I'm like, they were trying to make the mood lighter so I wouldn't be so upset and everything. And I was like, I'm fine. I just want to go home, and I'll deal with the emotion later. Just let me go home with my kids. I was fine until right before we go in, and they asked me about disposition. And I didn't even know how to answer that. Because what do you mean about disposition? Like, they're like, disposition of the embryo. What do you want to do with it? I said, what do people do with it? I have no idea. This is a new world of issue to me. I have no idea. So at that point, I hadn't cried one bit that morning until they asked me that. And then more people came in, and they were super nice and sympathetic. And the doctors who did the DNC were wonderful. That it was like the two main doctors were like a man and a woman, and they were just super sympathetic and they were understanding, and they're like, we know how hard this is. We're so sorry. You know, it's going to be okay. So then I'm like, I want whatever is the normal thing to do. And I honestly don't even remember what that is. I signed off on it and that's what it was. And I have no idea. Because like, what are you going to do? Keep it?
Yeah.
What do you
I'm
do?
not sure what the options even are.
I don't even know what I don't even remember what they asked me. And I was like, I'm good. Just get it out and I want to be done.
Yeah.
And then after that, I went through surgery. Well, they did say there was a chance I would lose my uterus. They just had to see what it would look like. And this part's a little funny. I woke up and I guess I kept yelling to my husband, do I still have a uterus? Like loudly, so like everyone could hear. And I do, so that's great. But then when we got home, I was fine in the car on the drive home. Everything was fine. And then when we got home, my in-laws were here with my kids. And my mother-in-law and my father-in-law gave me a hug. And I just couldn't control the tears. It would just, they just told me they were sorry. And like, what do you say? I don't even know what to say in that moment.
Yeah, I mean, and you know, with that, it's like there's just so many other things that are processing in your mind as well, and then you probably are also missing your kids and just being away from them and not feeling like yourself and having to go through this another loss of something you have experienced before. We aren't going to be able to get to all of the topics we wanted to cover just because we are well over time. Yeah. But I do want to make sure that we just recognize, you know, what comes next. I hate to do disservice to someone that's so important, but you did lose your mom after all of this. If you could just touch briefly on that, we are short on time though.
That's okay. You can cut things out because I ramble, so you can cut things out. So a week after everything had happened, my mom was unresponsive. She was in a nursing home because she had several strokes, so she was very sick for a few years. She had gone to the hospital unresponsive, and was on a ventilator for a few days, was able to come off of that and went to a different nursing home. But she continuously had like mini strokes and went to the hospital again. It was there for about a week. Barely could talk, couldn't eat, anything like that. On November 10th, she had coded, and at that point, there were talks between my dad, my brother, and I about making like a DNR for her because she was so sick.
Yeah.
We hadn't come to that decision quite yet, and so when she coded, they had asked my dad if she had a DNR, and he had said no. So they're, you know, trying to make her breathing, and she was on a machine that was just doing everything for her. And then the next day, we had to go and we had to turn it off. I don't know if it was a life support machine or what, but we did have to turn it off. And it was horrible. And
Yeah.
it was just, you know, a short time after. And it was on 11/11, which is supposed to be so lucky, and it isn't.
Yes. I mean, navigating grief in general is just something that everyone does so differently. If you, you know, how do you think that others can support someone that might be navigating similar challenges, whether it's pregnancy, postpartum, or grief?
I think just being there and offering even like the little things, like let me come bring you some food. Let me help you. Do you need to do your laundry? Do you want to go take a shower? Because I feel like after experiencing like pregnancy loss and losing my mom at the same time, even getting the energy up to take a shower with having to take care of the kids, it's like I didn't even want to do that. Like I didn't want to be there, be present, because I was just so devastated. Like my mom is my mom, and
Yeah,
my mom
absolutely.
is close, and nobody can replace that feeling, and it's way harder than I think is known. So I need the little things. Helping watch your kids so you can take a shower. That was huge to me.
Yeah. And if you could offer one piece of advice to a mother who feels overwhelmed or alone, what would that be?
Do not be afraid to ask for help. Somebody somewhere in some fashion, somebody is going to help you. Somebody, it doesn't matter who, a stranger. You could post on social media that you're just, I'm going through this, and somebody will be like, I'm going through it too. Let's talk about it. or somebody can just sit there and listen to complain about nothing will help them. Because my dad and my brother listening to me complain about nothing, and my husband listening to me complain about nothing helped a ton.
And my final question is, if you could tell your younger self anything, what would it be?
Don't give up on the pregnancy journey. After having a cesarean scar ectopic, I did end up having a scar tissue repair surgery. And I am glad to say that I am almost 7 weeks pregnant now with baby number 4.
Oh my gosh.
Yes, and we are done after this. Super done after this. But those doctors that told me I couldn't do it, don't stop trying. I looked and I found the best surgeon to fix the scar tissue problem, and everything's going beautifully. Baby looks
Wow. Well, first, congratulations. And, Melissa, thank you so much for sharing your story with us today. Your openness about challenges of high-risk pregnancies, postpartum depression, and grief is incredibly brave, and it's going to help so many people feel seen and understood. Motherhood isn't easy, and your strength is a powerful reminder that even in the hardest moments, there's hope, healing, and community. To anyone listening, if you're going through something similar, please know you're not alone, and there are resources and support out there for you. Thank you all for tuning in, and we'll see you next time on For The Hayters. Thanks for listening to For The Hayters. Don't forget to connect with us on socials, follow, like, and share to help more people find this community, and remember, they're not alone. And if you haven't yet, join our Facebook group. We'd love to have you there. The more we grow, the more lives we can impact.
What's your name and share your story? We'll be waiting.